Hi, marhaba, kifkon. My name is Rimel Shakawi and I'm a pharmacist working in Swansea Bay University Health Board.
And my name is Lamra Shakawi and I'm a GP in Uplands and Mumbles Surgery and GP tutor in Swansea Medical School. We are sisters. We are of Middle Eastern origin. We are half Lebanese,
half Egyptian
and fully Welsh.
Over the past year, we have all been affected by the Covid-19 pandemic. Unfortunately, many of us, including us, have lost our loved ones. We know that the ethnic minority community have been affected greatly by the Covid-19 pandemic. Unfortunately, there still remains hesitancy and reluctancy among our community to get vaccinated.
The vaccine was created by scientists worldwide and has been manufactured and tested at a really quick rate due to global effort and funding. In the United Kingdom, we have the Medicines, Healthcare and Regulatory Agency, which is an independent body that scrutinises and regulates all our vaccines and medications to ensure their safety and efficacy.
It is now time for us to do our bit, for our community, for our friends and our family.
We have had the vaccine and so has our dad, and we would strongly urge and encourage all our family, friends and everyone in the community to get the vaccine too.
If you have any concerns or any questions regarding the vaccines, please don't hesitate to speak to your GP or pharmacist who would be willing to answer any of your queries. Let's get through this together. Having the vaccine will not only be helping you, but it will be helping your family, your friends and your local community. Please help us get back to normality. Shukran, diolch yn fawr.
Thank you.
Hello, my name is Frank Banza. I'm the CEO of the CAE, and today I've just had my COVID-19 vaccine, and it all went smoothly, it went well, and I would encourage people from the BME community to have a positive attitude toward the vaccine. And if you have any questions, please do get in touch with your GP or a medical expert to give you more information about it and make up your mind.
Hi, I'm Dr. Jayaramachandran and I work in old age psychiatry. As a psychiatrist, I see a lot of patients with dementia in my line of work, and I've seen how serious a COVID infection can be in the at-risk and vulnerable people. So I wanted to get vaccinated, not only to protect myself, but also for the sake of my community and for the society as a whole. I've had both my doses of the vaccine now, and I haven't had any side effects except for a sore arm for a couple of days. So if people have any doubts about the vaccine, I would urge them to speak to a healthcare professional, make an informed decision and get vaccinated. I believe the vaccine works, is effective and is safe.
Hello everyone, my name is Natjat Kalra. I'm the interim head of value-based healthcare within Swansea Bay University Health Board. As a part of my role, I help our services and our clinicians deliver outcomes that matter to our patients, our staff, and our citizens. I did have concerns about the speed at which COVID vaccines were approved at first. I've also had an adverse reaction to a flu vaccine in the past, which made me hesitant about this one. In order to address my concerns, I spoke to BME colleagues and clinicians who work for the Health Board and community members. I also looked up the information and evidence myself on the gov.uk website, where there is lots of detail on the vaccines and the steps taken to approve them and frequently asked questions. This helped me weigh up the benefits and the risks. And now I understand that no vaccine is perfect. There could always be some side effects when you've had it, whether you've had a sore arm or headaches. So I have made a decision that when I'm offered the vaccine, I will be taking it to protect myself, my family, and the community. Diolch.